Hey everybody, I'm here with Dr. Brandon Brock, my esteemed colleague. I'm excited to have him. He is a PhD. He has a doctorate in nurse practitioner. He's a chiropractor. He has a myriad of degrees. I mean, this man is overqualified to see patients. I'm excited to have him. You like that one? I'm excited to have him here to share some insights. Let's get right to it. What is the nexus of neurodegenerative disease?
Well, there's a lot of things in neurodegenerative disease, and I got to tell you, Dr. Silverman, it is definitely not going away anytime soon. There is so much neurodegenerative disease right now, and so much escalation in like a post-COVID era. We're seeing rapid decline, not just in brain tissue, but in a lot of other tissues, cardiac tissue, just multiple systems. But the brain seems to be super vulnerable because those cells, they don't undergo mitosis, they don't divide, so they accumulate inflammation, they accumulate toxins. The body has to have the ability to process those things, and when it doesn't, it dies, it degenerates, it deteriorates, and we lose our function. So there's so many things that go into that loaded term, neurodegeneration. It can mean so many things that it just looks completely different to different people right now. I'd say it's getting close to 1 out of 5, 1 out of 6 people that are, in retirement age. I know the average age of neurodegeneration onset for females in my practice is we're seeing around the age of 52.
Wow, 52. And I don't know how old you are, but I'm past that. I don't want to hear about that.
I know it.
Which neurodegenerative diseases are you seeing most commonly in your practice?
Well, I mean, Alzheimer obviously is one of the is kind of the catchphrase and everything like that. But we see a lot of cardio, like ischemic changes,
Mm.
not enough blood flow to the brain, small vessel disease kinds of things. But then, we're starting to see just neurodegenerative disease, and sometimes it follows a really clear picture of one particular disease or another. But we're starting to see some mixed things. There's the expressive aphasia. You've seen some movie stars that have this kind of thing going on. There's some people that really maintain most of their faculties, but they lose short-term memory and geographic capacity of, they don't know where they're at and things like that. It's just been a real mixed bag. Some of the more sort of, out there conditions that you don't see quite as much are just becoming, I don't know if it's because I'm seeing more of them in my own practice or they're, gravitating towards me, but they are of all types becoming much more prevalent. And it really is devastating, because, you see people who just from a sheer point of a monetary perspective, when somebody can't work starting at the age of 52 or 53 or whatever, early on in their 50s, they have to have somebody take care of them. That's income. They can't make income. That's money lost. And then there's the system that is having to, put money into taking care of them. It's tragic for what it does, not to just that person and their family, but what it's also doing to our economy.
Yeah, I agree. Here. Alzheimer's is the most expensive disease with direct and indirect costs in America today. 6th leading cause of death in America, 7th leading cause of death worldwide. Number one cause of death of women in Australia. And there's no end to it. But it was interesting what you said in that a lot of the cardiomyopathy is a neurodegenerative disease. I
Yeah.
think that may be new to a lot of followers. I'd love you to expand upon that.
Well, when you start looking at, I kind of look at healthcare right now, and, maybe this is just my observation, but there's sort of like this pre 2019, post 2019 medicine right now. In other words, it's sort of like there was before COVID and now there's after COVID. And, of course, there's all kinds of controversy about what that means, but whichever part of COVID that you want to, think about, but let's just say COVID in general, we're finding that since people have had COVID, it seems like, especially those that are in long haul, we're finding that long haul COVID is really a neurological issue, but most people still have cardiovascular components. They have like the cardiomyopathy or the myocarditis type things going on. And when something's inflaming in the brain or in the heart, they're both tissues that are very susceptible to this. So we're seeing this running in groups. The cardiac system suffers, their energy output, their ejection fraction changes. They're not getting good blood to certain areas. Their brain is now suffering as a secondary, response. And then we see things that get affected like kidneys, guts, and other things. And so it totals this greater inflammatory burden. The greater your inflammatory burden, the faster this thing goes away. And so that's why I was saying it's not so much a specific condition, but it's the underlying burners for that, problem. Those underlying resonating inflammatory mechanisms are all adding up. And every time they add up, this goes down a little bit more with it, or it's more susceptible. So people really have to be mindful. And I think that medicine in the future is going to be more about preventing that stuff, because, or at least doing our best, especially if we have a family history of it, or if we've been very sick or we're very inflamed. Preventing it is going to be way more important than treating it, because once, we lose some of that that brain tissue, that brain matter, it's super difficult to get it back.
So it's inflammation. It's our body's inability to manage and modulate inflammation, or inflammation is too high.
Yeah.
So neurodegenerative diseases are based on that, but it almost seems that you're saying that neurodegenerative diseases are also have an autoimmune component where the body attacks itself.
Correct.
So that would be correct with Alzheimer's, Parkinson's, MS, etc.
Yeah, we think some of the mechanisms are sort of like this. It's like your brain has this wall around it called the blood-brain barrier, and this, and that thing. The more unhealthy you get, it seems like these barrier systems break down. And you have these barrier systems all over the place, but one happens to be around your brain, and it's meant to kind of keep stuff out. His brain has its own sort of ecology, its own environment to it. Something gets in there, you get inflammation, and yes, it does start to, inflammation destroys tissue. And the one thing the brain doesn't like is it doesn't like debris, meaning dead tissue, right? So if you have a debris field or a damp or dead tissue, there's all these, cells, macrophages, microglial cells are in the brain, but these macrophages can get in there and it starts to eat that debris, and it goes and it starts to create antibodies to it. And so now those antibodies will tag that tissue, and you'll get neuroautoimmunity from sustained inflammation. Real quick point is, if you have a traumatic brain injury, we know that's inflammation, and it can create a situation where you can sensitize your immune system to create antibodies to that tissue. And so you're prone for inflammation. And so now you get like a bad gut issue, or you get another infection, or something else happens, and you get a surge of inflammation in your body, and you can chemically reconcuss with no trauma. And I think that that's something that people miss out on. And those cells that make inflammation, if you continuously insult them, whether it be through trauma or other situations, they get sensitized. And those microglial cells don't turn off, and they will come after the brain over and over and over, but they don't resolve in regards to their attack. If they've been insulted enough times, or if they've been turned on enough times, they'll genetically change. And once they do that, they constantly come at the brain. And this is what we see in things like CTE with football players. And so when you start talking about neurodegeneration, there's a genetic mechanism, it gets switched. Then there's sustained inflammatory mechanisms from everywhere, switch. Then there's infectious diseases that, make it worse. COVID was something that you can throw in the mix of that. And if it keeps going, and then you add some insult from, things in your environment, like, I don't know, mold or another infectious disease, or maybe the inability to deal with your toxic load, it adds and adds and adds and adds. And so I think that we're getting a greater summation of all those things, and that is equaling more rapid decline in brain function.
So we talked about microglial cells, which are, as you said, the macrophages of the central nervous system. They're supposed to clean up cellular debris. The problem is that they're overprimed, and they're what we call, and you know this better than I do as a functional neurology expert, they're M1 versus M2 microglials. M1 are pro-inflammatory, they eat up tissue. M2 meaning they're just doing a good job like vacuum cleaners. And then you spoke really about the idea of how that ties into neurodegeneration and the idea with concussion. People don't realize concussion is an inflammatory issue. And as you said, it made the brain sensitive to secondary attacks, and it doesn't have to be a secondary impact. It can be an emotional attack. It can be a stressful attack. It can be an environmental attack. And I think they call that primed, or making the microglials primed. So what's interesting is, you alluded to the fact that there's a gut to brain axis. And as you and I both know, that the gut to brain axis is really implicit in neurodegenerative disease. So I want to pass the baton to you on that and let you go from there.
Some gut stuff in brain, is that what you're talking about?
Yeah, go for it, man. That's my wheelhouse. That's my super highway to health. Let's go.
It can be a highway to hell, that's for sure, man.
Right. There you go.
You know as well as I do, what you put in your mouth and what you eat you're eventually gonna become that. I mean, we just learned about that, intimately over the weekend, being stuck in a disaster zone. The more I learn about the gut and the more I look at it and, realizing that anywhere between 60 and 80% of your immune function is in your gut. We look at gut disease from your mouth, from one end to the other, right? And so people don't assimilate food because their stomach acid is off, maybe because their thyroid is off, or maybe they have an ulcer. Their digestive enzymes are not so great. Their gallbladder is not functioning well. Their microbiome, they have dysbiosis. And so it's all off balance. Their gut becomes leaky. They get damage to the lining of it. And as a result, they're starting, they'll absorb, larger molecular weight proteins, and that gets in the system. And the body's like, we've never seen this before. What is this? So it kind of maybe sees it as a virus. So you just create this inflammatory response, whether it be from bad food, processed food, poor digestion, poor gallbladder function, poor assimilation of nutrients, any of that stuff that's going on. And I think the gut, if you take that thing and you unfold it, it's the size of a tennis court.
Yeah, surface area.
In regards to its surface area. So anything that's going on in there, the body has a lot of defense mechanisms against it. But just like what I was talking about, there's more insults to the brain. There is twice as many insults to the gut with processed food, with food that's treated, processed, with different types of chemicals or modified genetically, or just manufactured, dirty, has a long shelf life and a bunch of, toxins in it. I really don't know. And this is just something that I just noticed. I don't even know if our food that's considered good, like our organic food and all that stuff, it still seems like it's a lower quality than what, is really should be expected. We just live in a world that doesn't have a good food source at least, in the States. I think there's different parts of the world, I think, that have better food than us personally, but we're constantly putting stuff in us that our body's having to fight and deal with. And I think it's a huge factor to that inflammatory burden. And when it gets in the body and it turns into inflammation, it's free game. It doesn't necessarily just say we're going to go pick on this system or that system. All systems are affected, but you may be more genetically prone for your heart to break down first, or for your brain to break down first, or for your kidneys to just, completely not, like what's going on, and your GFR goes down or something. So yeah, man, when we see inflammation, it's responsible, of the top 10 killers that are like accidental. We're talking about conditions like cancer, heart disease, diabetes. Inflammation is a big factor of 7 of those top 10 killers. And so that sustained inflammatory mechanism, yeah, it's heart, yeah, it's brain, yeah, it's guts, yeah, it's cancer. It's that resonating thing, excuse me, it's that resonating thing underneath. We have to deal with it. It has to be the epicenter of a lot of what we do. And it's not just stopping any, inflammation anymore. We're learning it's also managing the immune system. And if it's going way off one direction or way off the other, that's really controlling inflammation.
Well, to kind of like wrap up in a nice tight bow what you said, whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. It's bi-directional, and you communicate within a millisecond, which really speaks to how quick our nervous system works. We've talked about our immune system in long COVID. I think this is an interesting conversation because for me, and I think you and I are looking at the same condition with 2 different points, which is great. I think that long COVID is a mitochondrial problem. I think you thought long COVID was a little something else.
Well, I think what I was saying, that's a good point. I think that what we're seeing is that a lot of the symptoms are driven by neurological issues, but long COVID is 100% a mitochondrial issue. And so you got to say this, well, which tissues use, so much, a lot of mitochondria? Well, obviously the heart and the brain. And of course, we all notice the brain symptoms very quickly. I mean, in the heart, it's not necessary. I mean, you can feel flutter, you can feel like you can feel the symptoms, sometimes pain, angina, things like that. But if your brain is off a little bit and you have some brain fog, or you're missing words, or, it's very easy to realize some of those very subtle findings. And not only that, but, I just got to tell you, when your brain starts going down, and it's going down a little bit quicker, your brain modulates every system. There's nothing that's going on in your body that your brain doesn't know about. So if it is neurological, everything else suffers as well. And yeah, you're 100% right. I mean, when I do talks on long COVID and stuff like that, one of the first things I go through is mitochondrial health.
It's funny you say that because I have a little personal story. My dad brought home COVID. He was 89. My mom was 91. And she's a classic example of what you just said. Really, you depicted it to a T, because she got up and her balance was gone. And then she started to have difficulty talking. And each organ system over a 4-year period, I mean, obviously 91 to 95, she's not young. So her mitochondria doesn't resuscitate well. But, the death certificate, to make a point, was old age, but it really wasn't. It was just a shut off of all mitochondrial system function. So you're really correct, where the brain controls everything. So knowing that the brain controls everything, you are a functional neurologist, you're a nurse practitioner, you're a chiropractor. How do you put the three things together if I were to come in as a patient with some issues? Because you've got three vantage points.
Yeah. So it's been really interesting. A patient comes in, and most of my patients, they're not coming in for a single thing. They're not coming in for an earache or something. They're coming in because they're chronically ill. Rob, I mean, we make our roughly our weight in ATP per day. Once you reach about that age of 30, it's already going to go down 1 to 2% per year as the aging mechanism goes. And so when you look at it, it's just addition. It's mathematics. So if you're going to lose 1 to 2% of your oxidative phosphorylative capacity, or the ability to make ATP per year, if you're going to lose that, and that's the normal aging process. If you have a major inflammatory burden, a major infectious disease burden, you name it, now we're losing 3 or 4 or 5% per year. So your 40s or 50s now looks like your 60s or 70s if you're in a sustained inflammatory state. And one of the things, to get back to what you asked, is, okay, well, where do I start out? We do a detailed history. I mean, I got to tell you, I will dig and dig and dig and dig and dig and put together what I think is all the systems that may be impacted. And then I'll run labs on those things to see if there is indeed something going on in that system, and then I can measure it. And I'll do a physical exam to see if the objective findings meet the subjective findings, and see if the labs bring them together. And then one of the things we've been doing is we'll take all of our labs and we'll put it in AI now, and we'll crunch all that data together. And then we can come up with like a diagnosis, and it'll give us the genetic component, the inflammatory component, the immune modulatory component, the micronutrient deficiency component. And we put it all together, and it will start to draw out this nice picture of, these are all the systems that is involved in this individual based upon what we can do with our own technology at this given time. And then we just find all that, and I'll just kind of make it, I'll make it an equation. So it's like you have mitochondrial problems plus gut problems plus this, that, and the other. And then I'll just flip it into like a layered cake, and I'll just start knocking layers off of it. And I'll put the ones at the top that I think are the most important. And if I can get that right, then we can kind of start to reverse the mechanism a little bit and put somebody into a state to where energetically, physiologically, they can start to assimilate some health again. And they can start to go in the right direction instead of veering off in the wrong direction. And we can bring them back into that normal aging mechanism, maybe even reverse it a little bit or slow it down significantly. And if we can do that, then I feel like I'm not just treating a disease name, but I'm making their physiology, I'm giving them resilience. And when you give resilience, I think people can heal. And that's, I think, philosophically and just, structurally, that's how I try to treat people.
So you're looking for immune resilience, mitochondrial resilience, organ resilience. So for you, what's the captain of the ship in the body?
Well, mitochondria is a big one from a cellular perspective, and immune modulation. If you're going to break down just the immune system and make it fairly simple, your Treg cells to kind of orchestrate the whole thing, and that you don't have one part of the immune system drifting off and causing a bunch of phagocytic eating things, or, antigen presentation, tagging everything is bad. And then those Th17 cells that sort of kind of keep the cap on it. And make, another mechanism that helps the Treg cells go together. And one of the things that we noticed with COVID, for instance, is your T regulatory cells get significantly distorted, and then your Th17 gets distorted, and it allows for autoimmunity to go up. So it starts creating a situation where you react to the virus, but then it starts cross-reacting, and you make antibodies to your thyroid, to skeletal muscle, to skin, to brain, to heart. Dr. Vajdani and Dr. Karazian did a fantastic paper on the cross-reactivity between COVID and your other tissues. And the reason why I bring this up is because so many people are like, I've got this mystery illness now after having COVID. And we're like, well, your immune system was knocked offline and you have less resilience. And now your immune system is confused and you're reacting to all these different tissues. And now you have a skin condition. Now you have skeletal muscle issues. Now you have cardiac issues. Now you have thyroid issues. Now you have brain issues. And we could probably go on and on, but that's one of those things where you first of all, when you're treating that, you have to correct the mechanism that is offline. And then you have to start doing things to repair the tissues that have been damaged. And I'd say that the epicenter, what you were getting back to, is we have to protect those tissues, sustain their capacity to withstand the bombardment, and then we go back and try to correct all the systems that we can that is damaging that. And if we can get some mitochondrial health back and control the immune system, we can do all kinds of cool stuff with food, with nutrition, and even with drugs to bring the viability back to some of those systems. We know we can do it because we've done it. Much easier said than done.
Without question. So you mentioned a lot of blood serum markers that are implicit to immune health. You really talked about the immune system being pinpoint, but being confused. And when the immune system gets confused, it starts to attack or confuses self and foreign. It starts looking at the thyroid as a foreign object and attacks it. And like you said, it tags it and it makes antibodies. So basically, we're talking about long COVID and issues with COVID being a mitochondrial problem, but also an autoimmune issue.
Yeah.
And you referenced Wujijani and Karazian with the cross reactivity. It was literally to every organ system in the body because it was a gnarly thing. So let me ask you, let me set you up, let me tee up the swing for you, if you will. Would you say that one of the biggest problems we had in COVID was the fact that the American population was susceptible to autoimmunity because they were pre-inflamed, going back to what you said about most of your patients being inflamed when they're walking in the office?
I mean, beyond doubt. I mean, when you really start to kind of sit back and have a philosophical conversation with yourself or colleagues, and you're really, all politics aside, everything away, you're looking at this from a scientist or a scientific perspective, but a clinician perspective. And by the way, just about every clinician out there, whatever they're willing to admit, everybody is starting to see patients are different now. And so I just, you sit back and you look at this, and there is absolutely no doubt that, American civilization, number one, we weren't ready for it because that's just a natural thing. It was a new thing that it was introduced. I mean, to an extent, there's been SARS viruses to one extent or another, but not like this one, obviously. So it hits, population doesn't have any resilience to it, just from a sheer fact that there's no immunity and there's no herd immunity. And, we could debate all day long whether we dealt with it right or not. That's, a foregone conclusion. We have what we have now. And so it hit us hard, It's just like a new influenza strain or something where, again, nobody's body has ever really seen it before. And we have that infection, and then you have that to deal with it. You have all of those immune modulators that are coming in to deal with it. And that's that cytokine storm, that's that storm. So you've already been prone to inflammation. You already have maybe a mini storm going on, and then it just turned into a tsunami. And this is why, take one population that was really affected, it was obesity. Because, adipose tissue makes a significant amount of inflammation. It modulates inflammation tremendously. And so we know that when there's, expansion of adipose tissue or fat cells, it's already creating a little wave of cytokines. And of course, we can measure leptins and adiponectins and kind of determine how vulnerable you are. But that's just one example. And what's really interesting is, how do we protect people who are vulnerable? Well, the people who were vulnerable were the ones that were already inflamed. And some disease states weren't necessarily that. Some people were fragile because of, just what they were going through, but they weren't necessarily totally inflamed. Some people were fairly healthy, but really inflamed, and it got them faster.
Wow.
And I just, when you go into this, the underlying terrain, your body and your underlying physiological environment sets the pace for how badly this is going to get you. So when people come to me and they're like, what can I do to, with COVID? I'm like, well, let's just make your body as resilient as possible. I mean, an infection is an infection. You're going to get it, at some point in time exposed to this thing, which is one of the reasons I kind of thought running from it was kind of silly, because To be honest with you, in order to never be exposed to this thing that has a, the virility of it was so amazing. And there's no way you could get away from it. Everybody is going to get a taste of it at some point. My thing was, let's just build people up the best we can with food, with lifestyle, with emotions and all that.
I
So
love it. I love it. So that leads me to the next question, and I'm in concurrence with you. I agree that America wasn't ready. We weren't maybe mentally ready, but we certainly weren't physically ready. We're still not physically ready. I don't think enough practitioners talk about what are you doing for immune system, what have you done for immune system today. That
yeah.
said, why don't you give the followers 5 lifestyle hacks that you would recommend to boost their immune system?
Well, what's interesting is, we were talking about mentally ready. There's some pretty interesting literature out there about immune system. Take TH17, for instance, which is one of the, part of your immune system that kind of controls your ability to not go into an autoimmune state. I mean, if you're in a state of stress and emotional crisis and having a really rough time, you can throw off your TH17 system for months. So the first thing I would say is culture good relationships and put yourself in an environment where you can be as happy as possible and loving as possible. I know that that's easier said than done. Also, some people don't have that ability, but some people will make a choice. I would say make a choice to be as peaceful with yourself and as peaceful with those around you as possible, and just relax. So that's one thing. The second thing is quit eating crap. You got to eat some food that has some food can be either great for you, obviously, or it can be really bad for you. I mean, some people are like, should I eat this or not? I'm like, you should skip that meal, fast a little bit, and then just pick it up on the next round. So good food, good emotions, lower stress. And then another thing that I'm finding, Dr. Silverman, is that people need to have a clean environment.
Yes.
I know where I'm at, a lot of people are exposed to mycotoxins, mold, bad air. So I would say clean air, clean water, clean emotions, and then you have to move. You have got to physically exercise. And we're finding this in long COVID as well. A lot of people susceptible. They don't get off their butts and do anything, man. So move better, think better, eat better, make sure that your guts are better, you're eliminating better. All the basic things that we really don't think about, we take for granted, but we do it all the time. We need to do it better and be more vigilant in regards to doing it purposefully.
Excellent. Those are 5 things that everybody should be able to implement on proverbially Monday morning. Now, you and I both use laser in our offices, in musculoskeletal light, in an autonomic nervous system light, and an immune light. So a lot of people have asked me, could you explain how this laser, this non-thermal FDA-cleared laser, has an impact on the immune system?
What's interesting is we're creatures that function off light. I mean, if it wasn't for the sun, we would have no bioenergetics. You know this, obviously.
Mm-hmm.
What's interesting about laser is, let's go back to that, thing I was talking about earlier. And that is, you make roughly, it's about 80% of your weight in ATP per day. Well, we know that light, the photochemical effect of light, and, with laser, we're just taking sunlight and then basically, putting it into a source where it's a certain wavelength at a certain power, at a certain electron voltage. It's almost like harnessing sun and taking out just the element that you want. And when we do that, and we know that we get penetration into tissue, we know that we get, an impact on cellular function, but it impacts the mitochondria, man. So when somebody says, I'm feeling sick, I'm breaking down, I'm losing everything, and I'm like, there goes your 1 to 2% down to 3 or 4% of loss. So you're aging quicker, you're breaking down faster. Laser for me gives me the ability to activate that mitochondria, to make your weight in ATP per day, to be more resilient, and to start going into a state of healing or stopping the downhill mudslide that you're having as far as energy production. That's what I love about it. And of course, laser has more effect than just mitochondria. It does have an effect on the immune system, so there's not so much inflammation. It does affect the mitochondria. It does help heal barrier systems. It does help modulate those microglial cells. So it really is one of those things. It's a very versatile tool, that we can use.
I agree. And, you and I get into the rabbit hole or the depths of conversation in the different types of wavelengths. The 4 or 5 nanometer, great for immune function, really good for sympathetic nervous system. The green light's great for immune function as well. The green light also helps with stem cells. And the red light, the interesting thing or the twist to the red cell is it increases interleukin 10, which is one interleukin that is anti-inflammatory and conversely also shuts off TNF alpha, interleukin 6, interleukin 8, and interleukin beta. That aside, my question to you to really kind of wrap it up with the laser is, what structures do you like to use the lasers most on, and which organ systems?
Well, I mean, aside from the common joint pain, which there's really not a debate anymore whether or not lasers help with joint pain or joint function, or, I'm not going to say necessarily regenerative capacity, but at least an integrity capacity of your joints. I use a lot of violet for infectious diseases. We have a lot of infectious diseases that come into our practice. I mean, Dr. Silverman, I love nutrition. I love medication. I love procedures. And, I love, research. I like all those things. But again, laser on top of it or intermingled with all of it, I love. And again, I love that violet wavelength. It's really difficult, again, to debate that it has a fantastic antimicrobial effect. And I have so many patients that, especially after something like COVID, their immune resilience is so bad that they're very prone for secondary infections. So if we can use laser to help, like I even have people coming in, superficial wounds don't heal that well. And laser works miraculously for it. And yeah, we do use laser on brain, especially at the right settings, which I think is really important. A safe, configuration of, how we use it to enhance the mitochondrial function in heart and brain. And I do like using it for those things. I mean, I wouldn't say that it has all of the woo-woo FDA kind of stuff around it, but we do know that the literature is really deep, that it does help cellular function. So when you look at that and you just extrapolate it, we can use it in multiple systems to give the resilience so that we can repair the system and pull it all together so that we can give that tissue, that organ, that system a fighting chance for more survivability. And really what I'm looking at is this, we've all got an expiration date, but I'm just looking for quality of life during that time period for somebody. They can go on a walk, they can be happy, they can not be depressed, they don't have crippling anxiety, their brain doesn't start to slip as much, their heart can enjoy going out and doing the things that they, want to do. They don't hurt so bad that they want to be on narcotics. And then that's a whole nother issue. So yeah, I know I took a little bit of a tangent there, a little bit of a turn, but that answer to me is so important, man. It is so, so, so important.
I think the overriding theme was that laser is a device that most people should utilize, and it's non-thermal, low-level laser, true laser, not infrared. That's good for heating a sauna.
Expensive hot pack.
Yeah. Heat has its place. It also can be detrimental to one's health. We know that. And mitochondria is the baseline for the idea of health span versus lifespan, i.e. longevity. Yeah. But I introduced you and I said that you were a functional neurology guru. Now, I know everybody's going to say, what in God's name is that? Is that a neurologist? Is that a chiropractor? What is it? What does it entail? What's the training? And how do you differentiate yourself from other type of practitioners within that light?
I would say a functional neurological practitioner is really its own entity, sort of, in a way. I mean, I don't know that it is a chiropractor. It's definitely not a neurologist. A lot of people are like, "Oh, you're trying to be a neurologist." I'm like, "No, I'm not. I don't want to do that. I don't want to do just an exam and say, oh, this cranial nerve doesn't work, or this system is, you got weakness here. See ya." A functional neurologist will look at a neurological exam and they'll do it, and they'll notice that certain systems are intact, but they're very poor. They fatigue very quickly, or they don't have the right output, or the input coming in is not assimilated the right way. So therefore, what you see as a result with the motor output per se is distorted. A functional neurologist will look at the nervous system and realize that it's plastic. It's almost picture it as malleable. You can put, action potentials into the system and it gets integrated and you get more plasticity, more synaptic connectivity. So therefore its output or its function is more efficient or is appropriate for what it's supposed to do. That's what it is. Functional neurology, no matter how you package it, has been around forever. If you do any kind of rehab, if you do chiropractic care, even medications, create plasticity. The thing that the functional neurologist learns to do is say, this system is not working well and it needs better assimilation, better integration, and better function. And they can figure out what they need to look at to monitor that. And then they can do whatever modality they want to use. I mean, lasers one, movement, exercise, light, sound, all these things that if you get good enough at it, you can start using those modalities to get into a certain system specifically and try to activate it and raise it to a level to where it's in harmony with the other systems around it. And, it's just like fine tuning a race car, right? I mean, you're just making sure that everything's working the right way so that it goes on down the road and can do what it's supposed to do. So that's functional neurology. It's activating the nervous system to do what it was meant to do the best it can. And the thing that I love to add into functional neurology is this, and then I would say this to most functional neurologists out there, and many of them don't like it when I say this, but quit trying to activate a system that is so sick it can't handle it.
Mm.
I mean, if you have sustained inflammation, if you have bad mitochondria, if those neurons are so damaged that when you try to act them, they cannot reconnect with one another or create synaptic connectivity, please learn to go back and make the system healthy enough to receive what you're doing therapeutically so that the integration and eventual output can be appropriate. Otherwise, it's like painting a burned house. Rebuild the wood, get something nice, then repaint that thing so that it looks right. To me, it's the evolution of functional neurology that's important. It's not that functional neurology does or doesn't exist. It does. The evolution of it is make that system as stable and as healthy as you can so that when you activate it, it responds as well as you want it to. And if you take laser, for an example, laser has allowed us to do that better. If you take nutrition has allowed us to do that better.
Great.
Sometimes even medication allows us to do that better. The skill is finding which modality is going to allow you to do that better, and then find the stimulation that can allow you to do it at the same time. I love it because it's a beautiful story. It truly is an art. It's an art to be able to do that.
So the functional neurology, which is specific to chiropractic, am I correct?
I mean, historically, yes, many of the people who are really good at functional neurology are chiropractors, but what we're finding is it's non-denominational at this point, meaning it's in the medical world, it's in the PT world, it's in the OT world, it's in therapeutic optometry. It's all over the place now because people are realizing what they do has an impact on the nervous system. So I don't know that there's really any one profession that owns, functional neurology. And thank goodness, because we want as many practitioners that are qualified to be able to do this and do it.
So functional neurology, you're utilizing as a diagnostic skill to determine what system in the body may be aberrant or dysfunctional.
Yeah, I mean, well, that's in part for sure. A good functional neurologist will really be able to do something like look at an eye response and say, there's a breakdown in movement there. That means this. There's a pupillary fatigability that's not necessarily, appropriate. Let's see what that means in regards to fatigability. Your coordination is off a little bit or something. So, you're doing something to now change that, that coordination, like, cerebellar activation, maybe per se. Mm-hmm. Or there's a little bit of a movement disorder. So you're trying to do something to reestablish neurological function to make that better. A good functional neurologist will be able to recognize the little subtleties in that exam, not just the gross abnormalities. And when they find those things, they go back and they try to fine tune that system so that they can see, because a functional neurological exam is a living exam. As you're doing it, you're noting what's wrong, and then you're challenging that system to see if you can make a change. And then when you're done, you have all these different things added up and you combine that into therapy. And that's what you start administering to the patient at a rate that they can tolerate. And then you start to see if it's possible, and not all of these systems respond, but if it is possible, you start to see those things get more fine-tuned. They're reduced in their output. And the functional neurologist can say, man, I activated the right system. I saw the right things. I assimilated information in the central nervous system. And now that output is so much better and they're living better. And it's not just movement, but it's also things like assimilation for gut digestion. It's assimilation for better, communication within your brain to have expression and communicate with others or perceive what others are saying, or to not be depressed, or to not be agoraphobic, or to not be anxious, or to be able to move through your world and it not be distorted with vertigo or something like that.
So we're getting towards the end, but I wanted to ask you this, being a nurse practitioner, you can administer medications.
Mhm.
What medications have you found to be most effective for the American population? Look, we both agree that we're living in Farmageddon. You know, we're 4.24% of the world's population. We use 52% of the world's drugs, 80% of the world's pain drugs. I get it, but that's not because of you. So I'm curious, which ones have you found? Because people always ask, is this an effective medication?
Yeah, man. Well, that is indeed a tough question, but it is the $1 million question, or maybe the $1 trillion question, however you want to look at it. I tend to kind of follow the line of thought of this. Yeah, I'm not a hater of any part of healthcare, really. I mean, I love doing small surgical procedures. I love using for me, it's like, here's medication. It boils down to this. If I need to use that as a tool to stop something from happening or to control a system from being completely, decimated, take antimicrobials, for instance, I do use those in my practice because infections got to die sometimes. I don't know that I have the time always. And again, this is the kind of thing that lights everything up. Some people get really sensitive about this, but just follow me on this. I would love to be able to fix everything holistically.
Sure.
Herbal stuff, fantastic. Even homeopathic stuff, great. Obviously, nutrition. But there are times where people they're so infested with, disease, you have to use medications. I use them when they're appropriate. I don't overuse them, meaning if I have another way to impact that system with something that's not quite as side effect-ish, then I'll do that. But I don't hesitate any to utilize a medication if I can do it and it gets rapid results. And then I can kind of go back and sometimes, like, take an antibiotic, for instance. I will use it. I know but I know how to go back and deal with the microbiome either at the same time or afterwards. So maybe that they get a better result. And again, couple that with laser. I mean, I've had several patients come in recently with really bad wounds that that aren't healing well, and they're on medications that really cost thousands and thousands of dollars and really significant side effects. If I can add laser in with that and they don't have to use it as long, or they get a better effect and it doesn't damage them as much in the long run, then absolutely I'm going to use it. So people ask me all the time what I think about medication or the world of the pharma world. Well, I think it is life-saving. And I love it when it's done right. It's not the only tool I have, so therefore I don't have to overuse it.
So we have an election coming up. I am going to be the next president of the United States, and I've decided
I'm voting for you then.
Yeah, you got it. I love it. I'm a great write-in vote. It's Silverman with one and not two.
Only if I can be your VP. Can I be your VP?
I'm going to give you a better job, a great job.
Okay, good.
And the job is I'm going to put you in charge of health, fitness, and wellness for the American population. And you're going to instruct them to do one thing. What are you going to tell them to do differently to avoid neurodegenerative disease?
Well, this is going to get me snuffed out, Dr. Silverman, if I say this one, but I'm saying it anyway.
Go for it, man. I'm here to help.
I'm going to go back and change. I'm going to change all the policies on food production, and I'm going to support our farmers and give them resources to do what's right, and then train people to do sustainable farming and take the one thing that is important to all of us, and that is food. Remember, the most powerful drug in the world is food.
Without question.
You asked me about drugs a minute ago. Well, here it is. You are what you eat. Within what is it, 3 months, 60 days, maybe even up to 6 months, every cell in your body is going to regenerate except for brain and muscle, right? So if you eat a certain food, you're going to kind of turn into that. I would be like this, what we're going to do? We're going to clean up our food supply and we're going to catch up with the rest of the world in regards to.
Well, it's been said pretty famously, let food be your medicine, let medicine be your food. I have my esteemed colleague. I want to thank him so much for giving us knowledge bombs, Dr. Brandon Brock. We've got to do this again. By the way, so everybody knows, that man is in Mexico and he took time on his vacation to spend it with me. I am jealous, but I'll get over it.
Wish you were here, buddy. Wish you were here, man. It's been good to see you recently too.
It's good to see you after what we went through. Yeah. It's great to see you. Dr. Brandon Brock, Rob Silverman, Proven Health Alternatives, always yours in health.